everybody, I'm Dr. Carolyn Rutter. I'm a radiation oncologist here at Benefis Cancer Institute. And for Breast Cancer Awareness Month, I get to chat with you all a little bit about breast cancer and mainly some questions that folks submitted over social media. So that'll give us something to talk about today. So thank you for joining us. This was such a sweet question. I'm sure anyone asking how to support friends and loved ones with breast cancer will already do an excellent job. What I'd say is that people going through breast cancer treatment often have a lot of decisions to make. And I think listening is one of the best ways that people can really offer support that's meaningful. A lot of times people have more than one treatment option, and a woman has to decide for herself how aggressive she wants to be. And it's really nice to have a safe place to be able to talk about what she's heard from her various different doctor's appointments, put together all of the pieces of her journey step by step, because it can be very confusing. We don't just hand people a roadmap. The pieces kind of come together one step at a time, and you don't always know what's going to be 2 steps ahead. So being able to talk through that with someone is wonderful. And especially someone, really safe, who will do a lot of listening and help her think about what's most important to her and make the choices that make the most sense to her with her own priorities and concerns. It can be very hard for all of us to not encourage a loved one to do what we think is best. That's a very natural thing. But I think patients have the most peace when they feel like their loved ones really want them to decide for themselves, and have a way to talk through that and sort of learn about themselves in that process. But I find that the people who really have a journey that's the most sweet, we wish no one had breast cancer, but it's really lovely to see how a lot of people come through it and tell us how touched they were by the relationships and the people who reached out to them. And it can be very little things, like just messages that we're here for you, we're sorry that you're going through this, you're very important to us, we care about you, and you're not alone, we're in this with you, how can we help? Lots of those little messages just make a huge difference to a person, and they really keep that long term after their fight's over and they're survivors. It can be a precious thing that made something we wish they didn't go through into a really sweet journey. So yeah, and little things like rides. Often there's a lot of visits that people need help with, that kind of simple support, bringing a meal, things like that. So thanks for asking. Breast cysts are actually really common among women and usually not cancer. And so the last thing you'd want would be to have an excess number of pokes or other procedures that could cause pain or scarring or infection or other problems for something that wasn't actually dangerous. So when it comes to cysts, watching them with imaging is usually the very best way to go. And we have wonderful breast mammogram imaging available here with excellent radiologists to read those studies. And so they give very good advice about when there should be repeat imaging to keep a close eye on a cyst that maybe they're uncertain about and want to watch more carefully. So it's always hard to wait, but generally those cysts are going to be turn out to be nothing, and you're better off just watching them. I like to call it the test of time. How will things change over time is one of the most powerful tests sometimes that we have. So worrying is something I'd encourage you to not do, since it's so likely to just be nothing in the end, and you'll be safe if you're being watched. I did not actually know before myself that there was a link between grapefruits and breast cancer, but it turns out there is. You have to eat more than a quarter of a grapefruit a day to increase your risk of breast cancer. Grapefruits are kind of funny. We think of them as being super healthy, but they actually interact with how our body breaks down a lot of different substances, including some medications. So you kind of have to be careful with grapefruit anyway. But when it comes to breast cancer, what happens is it impacts how our body, what it does with estrogen. And when estrogen levels are too high, we can increase our risk for breast cancer. So kind of the short story is 1 grapefruit a week or half a grapefruit 3 times a week is a safe amount. But anything above that, you might be getting into a little bit of a danger zone. We also know when it comes to diet that limiting fat intake has been proven to decrease the risk of breast cancer. We all know that eating less sugar is generally a good idea for all of us. And then other things associated with breast cancer are tobacco use and cigarette smoking. And then alcohol is one that's recently been shown in studies to have a very strong association with breast cancer. That being said, light and moderate drinking doesn't increase the risk of breast cancer very much. Sort of the more a woman drinks, the more her risk will increase. But most doctors feel that 3 to 5 drinks or less a week is a safe amount, where any increase in risk would be very small. So that's kind of a good goal, I think, for people to try to have. And then exercise is one of the most powerful ways we can reduce our risk of breast cancer, and the more the better. But at least 3 days a week of some good vigorous exercise can make a difference. So anything you can do will help. We do have a breast cancer support group here at Sletton. It's called Our Journey, and it meets here in the Cancer Center from noon to 1 every Thursday. And then there's also a Zoom opportunity available for people who would like to participate from home. And you could call Sarah Grotbo, our social worker, at 731-8248 for more information about how to be connected to that opportunity. And I've been assured that it is a very safe and private opportunity. Please contact her if you'd like to participate. We're very blessed here at Sletton to have a full-time genetic counselor, Betsy Smith, available, and I reached out to her to get help answering this question. So seems like every few years, more genetic tests are added to the current ones that we have as we discover more and more genes that may be connected to breast cancer. So if it's been more than a few years since a family member was tested, that family member might ask their physician if their test is up to date, because further testing might reveal genes that we simply didn't know about when she was tested the first time. But for that individual herself who has a strong family history, she'd want to at least start breast cancer screening at age 40, or possibly 10 years before her youngest close relative who had breast cancer. So that'd be a good thing to discuss with a primary care provider if any of those relatives were under age 50 when they got their first breast cancer. But the patient herself, who has a strong family history, even though the family members with breast cancer didn't test positive for a breast cancer gene, she could still, if she likes, reach out to Betsy and make an appointment to come in and talk about that family history and see what her individual risk is, and if perhaps she would like genetic testing or would qualify for it, even if she doesn't herself have breast cancer. So I love that that opportunity is available here. So this is a great chance to remind everyone of the power of screening. With mammograms, we see more and more breast cancers picked up so early that they are very, very easy to manage. with maybe surgery, little radiation, or a pill, not large surgery, large radiation, chemotherapy. The earlier we catch them, the easier it is to treat them, and the more likely it is we'll be successful. And the more breast cancer, even though we can't eradicate it completely, can turn into a problem that can be relatively easy to handle. And I'm really grateful to see that. Well, thanks so much for joining us, everyone. I appreciate this opportunity. And if you have further questions, feel free to give the Cancer Center a call at 406-731-8200.